Hello, everybody, and welcome to Adoctorsjourney podcast, navigating life and medicine with coaching and healthcare innovation. And I'm your host, Miguel Villagra. I'm the founder of Adoctorsjourney. It's a coaching platform that offers support to physician entrepreneurs, and healthcare innovators that are interested in kind of finding clarity on their next step on their journey. And today, we have an amazing guest. She's gonna share her story. I've been trying to chat with her for quite a while, and let me introduce her, Dr. Lillian Emlet. She is an academic physician, simulation educator, and a certified professional coach that specializes in energy leadership. I'm so looking forward to hear this part. With over 2 decades of emergency and critical care medicine, she is the founder of Transforming Healthcare Coaching to help clinicians rediscover their purpose and elevate both personal and professional aspects of their life. Dr. Emlet's innovative approach emphasizes the pivotal role of energy in leadership, aiming to transform healthcare from within. Lillian, I'm so happy to have you and have this conversation today. How are you doing?
Good. I'm so excited to be with you today.
That is fantastic. Oftentimes, I kind of like to get started by kind of bringing all these entrepreneurs and healthcare innovators that are disrupting the industry, or supporting those that are disrupting the industry, to share their journey, where you're coming from, what you do, and how has been your journey into medicine, coaching, and healthcare innovation.
Yeah. So for me, my parents wanted me to become a physician. So I came from a very small rural town in Pennsylvania, and I circled the state in Pennsylvania, going to college and going to medical school. But my journey was that they wanted that dream for me, but I sort of took a circuitous route where I, went and did research for a couple of years. I got a master's, and then I chose on my own terms to go to medical school. And then back then, a long time ago, I wanted to become a surgeon. But instead, I chose emergency medicine because it was the allure of 24/7, 365, being able to take care of everybody, being the Band-Aid for the healthcare system in general. And then when I entered into emergency medicine residency, it was really challenging. I felt that everybody was angry at me all the time. The patients weren't happy to be there. The consultants weren't happy that I was giving them another patient to see, in consultation. And I found that everyone was angry. And so I ended up in my very first month in July, you all probably can remember those days, when you are an intern in the ICU. And I fell in love with the critical care. And back then, there was no pathway to critical care training for emergency physicians. So it's been a long journey, and it's been an exciting one in terms of opening multiple pathways over the last 15 years for emergency physicians to enter into different types of critical care training. And that was part of that journey from a national perspective and a board certification perspective. And I've been practicing, teaching, being an associate program director, and teaching many, many critical care physicians of many disciplines. Here in Pittsburgh, we have all specialties represented, neurology, internal medicine, anesthesia, surgery, emergency medicine, neurosurgery. So it's wonderful to be able to be so multi-specialty, multidisciplinary in my academic career. And then the pandemic hit, right? So I was in my groove, just doing my usual academic thing, right? Teaching, simulating, doing the thing. And then a respiratory pandemic that we thought was going to kill us actually in 2020 happened, and the world shut down. And my entire academic world shut down. And we focused on the laser-like precision of just the most important thing. And that was just getting through the day, being a team support to each other, and actually providing excellent care throughout the pandemic. At the same time, personally, I was actually going through a divorce. And so it was a very interesting time in 2020. And to emerge the other side was actually because of a coach. So it was because of my coach that I was able to thrive actually through the pandemic. And that's sort of how I ended up thinking I actually probably can pay this forward, and went back to school, in the residual times that we were still hybrid and virtual in the pandemic. And here I am with many other coaches, all in healthcare. We started Transforming Healthcare Coaching because we actually support all specialties, disciplines, professions, executives, to frontline clinicians in healthcare, to try to support all people in healthcare, not just one discipline or one specialty, because my background and my roots really have always been about the house of medicine and not necessarily the tribes of medicine, where it's really not just about one specialty. We all serve a role together to take care of lots of people, lots of systems. And so whether you're a physician, a nurse, a pharmacist, that's sort of what we're all about.
Totally. What a beautiful story and so much to unpack. One of the things that I want to mention as you were discussing, how you see the hostile environment in healthcare that oftentimes, unfortunately, that has become the status quo, right? So burnout, moral injury, physicians are so dissatisfied, sometimes with their journey, with their career, with the lack of support. It's a systemic problem indeed. However, I truly believe that everything starts with the individual, and the way we can reshape the healthcare system is having empowered physicians that are ready to take action and make that change. Now, you did allude to something that it's very important, and is how you came across coaching in those instances, right? In those crisis moments, right? During the pandemic, which I can, believe it or not, that's exactly the journey that I went through. I found coaching myself also through going through a similar experience a couple of years before the pandemic, but definitely the pandemic kind of speed up my interest on getting more into entrepreneurship, have other stream of incomes and so on and so forth. But let me ask you specifically how you came across coaching and how this has shape or reshape maybe even the way you see healthcare now.
Yeah, so when I discovered coaching, it was mainly because through the process of trying to mediate and get through the divorce simultaneously while trying to also be a single parent and work my academic job and figure out how to juggle all the balls, I realized I actually needed skills and I needed someone just sort of alongside me to be able to get through all the projects, be able to communicate more effectively, mediate more effectively in high conflict situations. And I realized that I wasn't depressed, I wasn't upset, I just needed better skills, and I needed to know that someone was there almost secretly guiding me on the side, if that makes any sense. And so I found my coach, I think either by divine intervention or by listening to try to learn information, and so much of it becomes first the curiosity and the seeking, right? And when you find the information, sometimes those resources are available to you. And when I contacted her, she actually is an empowerment energy leadership coach. And so this is, as you can see now, why I ended up choosing energy leadership training as well, the same training program that she went to. Mainly because energy is everything, right? How we approach energetically can completely shape and change. The worst situation can be very different for one person if you approach it from a different energy, as compared to someone if you're approaching into the same situation with very low or catabolic or destructive energy. We've all seen this in our teams. Those who are just unhappy and not well inside can actually poison an entire group. And that's why when people leave, there may actually maybe 3 or 4 people that leave at a time, because it is in some ways like metastatic cancer. It will continue to grow and fester if we don't do something to make ourselves whole and healthy again. And there are many factors why that can happen in a group, a team, an organization, or an individual. But in terms of how that happened for me was because I found a coach who was holistic in that approach. Because you'll find coaches, as you know, and as you yourself probably had when you chose your own training program, with very specific either cognitive or positive psychology focuses or embodiment. They have very specific focuses or executive, for example, but energy sort of encompasses everything in the life coaching field. That way, it's a little bit more generalizable with how people interpret how they show up to life.
Got it. So I want to ask you a little bit more, if we can get a little more granular on energy leadership. How do you think these? I totally agree with you with the concept. Energy is something that speaks by itself when you interact with a person. You can definitely kind of pick up very easily what mental state you are, what emotional state you are, and what type of energy you are reflecting in others, right? So in healthcare, it's so challenging, right? We're dealing with sick people that is sometimes at the end of life, and our energy levels usually kind of plummeted, even through the day, over the course of weeks and days. So what I want to ask you more about how this concept you do apply on a physician, on a healthcare provider, on the regular basis, how this concept works.
Yeah, no, that's a great question. So in all our clients, we begin an orientation in terms of understanding the 7 levels of energy. And sort of just generically, without getting too much into the details, a lot of times we have an ideal state where when we are in our best, most whole, rested, creative, loving self, we have a certain type of energy frequency, right? And when you think about that for yourself, you can see that, this is when I am rested, fed, with the people I love, doing things that stimulate my brain and actually are in alignment with my values and in alignment with my purpose. And alignment with values and purpose are not always so easy for any individual to identify. Actually, even for me, it took me months with working with my coach to realize I may not know my values, or I'm not 100% sure now midlife, what is my purpose? Because you acquire identities over time. And are you just the title that you have on your CV? Probably not. There are actually deeper things that you value in your whole person that does take a little bit of time to unpack in terms of what's actually truly important to you. So for example, one of mine is freedom. Another one of mine is creativity. And I had forgotten and had not known about these things until I started working with a coach to identify them. So when you're in that state of the optimal alignment with your purpose and your values, you have an energy frequency. And we actually have an energy leadership index, which is a proprietary assessment tool in our coaching programs and from the coaching program that I trained at the Institute for Professional Excellence in Coaching. That is a psychologically valid, tested instrument that we use at the beginning and at the end of our coaching programs to see where are you showing up. And then there's always an idea, like if your best state is a higher number. So it's levels 1 through 7. And that tends to be what we call anabolic, meaning you tend to be, when you're your best self, someone who's actually going to be growing, building, striving, creative, all of those types of growth. I mean, we understand this as physicians, growth, anabolism sort of energy. And of course, it makes sense that when we're hurt, when we're bullied, when we sustain trauma, when we have moral injury, it's normal and it's therapeutic to actually go into victim mode, hurt mode, quiet, angry, right? And this is sort of where we see most of healthcare right now. 2/3 are burned out. 1 in 3 is healthy, 2 in 3 are not. And so it's normal that we're walking to an environment where most likely throughout the day, you're going to sustain some kind of moral injury, burnout, unhappy vibes, right? Energy, whatever you want to call it. And you'll have to go back and recuperate, because the reason for lower levels of energy and catabolism is to heal. We know this as scientists, we know this as physicians. Tissues, when injured, need to heal. And so we need the quiet time and the rest and the anger and the reflection and the time to sit in the emotions. And so rather than vilifying or suppressing all of those emotions and anger, we need to just be with it, recognize it, process it, and move on. And the faster we can get through the catabolism to get back into anabolism, that's where energy comes from. And it's interesting to just walk my own journey for the last 4 years with the same energy leadership coach. I mean, it took 2 years, I think, for me to really understand the how quickly I get back up again is really my superpower now. To recognize it within minutes, rather than back in the day, it was like, I recognize it after I slept on it for a night, right? Because we so want to fester, we're just so angry, we're just so hurt. It takes so much time to recover from burnout. And so for those, people who are listening, who are burned out and who are trying to find information, from your podcast and think about creative ways, you're doing the right thing. You're getting information, you're starting the first step of your own journey, which is why it's wonderful that your podcast is named, The Doctor's Journey, because it really is about seeing what's out there first. And eventually the reality is all of these little nuggets will get you out of the place of first needing time to just rest, be angry, be sad, be hiding, be listening, be learning about yourself so that you can rise up and find a different way forward. That's
beautiful. So much to unpack. And so first I'm going to say, though, one of the things that struck me about what you said about the value and the purpose, right? Because it all starts to have those insights. And oftentimes you need a lot of reflection and time. It's not something will happen from one day to the other. It really requires a lot of work. Viktor Frankl described it so nicely. Right now we are in this existential vacuum. People don't know what their purpose is in general, in life, specifically in profession, or even sometimes in their personal life, family, etc. And knowing what you know, or even getting to discover what you didn't know or forgot about, is very, very important. And I love what you were mentioning about coaching, because I think that, I guess both and I have kind of the similar story, that we came across the concept of coaching, having that guidance that help you, guide you through this journey of self-discovery and insights, and even kind of identify, because oftentimes it's important to identify the things that you forgot about or you don't know. In other words, your blind spots, right? So what are the things that you might not be seeing, right? That might be out there, but you are just experiencing these symptoms, right? This itch that something is wrong, and yet you just keep moving forward because we in this automatic life, which is our new status quo in society, scrolling through your phone, full of distraction, numbing with alcohol, etc. You basically are living a life completely, in the matrix, right? You are kind of not yourself. You are just in the matrix, right, of the automatic pilot of life. So I think that definitely, oftentimes physicians, I think that they feel dread about the concept of coaching, right? They feel like two things. One, trying to get help is a sign of weakness, right? We are meant to be working 72 hours. We're meant to be, facing all these challenges and survive no matter what. But two, I think there is also a component of ego, of recognizing actually that you really truly need somebody to help you to heal inside. But oftentimes you feel like with this physician persona, how I'm going to express or show up all of those things that are hidden inside. So I want you to kind of see when you go to with your healthcare leaders or physicians, practicing, etc., what are the typical pushback that you might hear from them, and how do you address those points?
It's really funny. The people who I don't get pushback from leaders, because most leaders, by the time they're division chiefs or chairs or even higher than that in the C-suite, they all have been assigned a coach before. So coaching in business in the healthcare industry and most other businesses, it's normal. It's actually normal once you become a mid-level manager. And the hard thing is not every organization has programs that is freely available to frontline clinicians. They usually reserve that through the pipeline of how they want to talent develop internally via the hierarchy of the organization. And so that's why most people haven't heard about it. And so part of our organization, Transforming Healthcare Coaching, is to try to democratize that across professions in healthcare and gain awareness that basically this is one potential tool in the toolbox that many well-being programs can actually use to prevent burnout, because you're investing at the front lines well before you let people almost drown or drown fully in the burnout. You can actually give them coaching so that they never get there, because they can become more intentional with their growth in their life, so they can be more in alignment with your organization. And so this is what we're trying to spread message-wise. I actually get more pushback from people who are mid or frontline who were assigned a coach because of behavior. So meaning like there's something wrong with the dynamics of this team, or there's everyone seems to be angry or upset here, or there's too much high burnout rates. We're going to mandate coaching. So it's sort of like we're going to put everyone on a fitness regime. It doesn't work that way. I mean, you and I both know. Mm-hmm. You have to be ready as a client to actually want to commit to the relationship, commit to the work, and commit to the accountability to yourself to actually make progress. And that's why coaching may be perceived as a higher ticket item, right? In terms of, you go to a group exercise class or a group yoga class, or you do some kind of large scale intervention trying to help people in well-being or programs of the organization. They just have a different price point, compared to individual coaching, because we have greater efficacy at the individual level, because it's sort of like having your own personal chef, a personal trainer. You do get better results when you're one-on-one. And so that's why it's reserved for people who are usually at a high up enough echelon within an organization. So those are, I would say, I really don't get as much convincing needed for people who are in leadership positions. The hard thing is trying to figure out who do they want to actually invest in, how do they allocate those dollars. It's much harder to convince a frontline person, primarily I think because we ourselves don't see ourselves regular professionals, nurse practitioners, nurses, physicians. We don't see ourselves as supreme athletes that go into the zone of the hospital or the healthcare system or the clinic or wherever. We're entering into a really high demand, high emotion, high technical expertise, high cognitive expertise, and we don't see ourselves as supreme athletes as we go into it. And I think if we did, we would think, of course I would have a coach, right? Because every single pro, tennis star, Olympic star, they have coaches. They have a team of coaches. And as we know now in the entrepreneur and the business world, this is also normal. But in healthcare, for some reason, we don't perceive ourselves that way. And I think it's only been used in sort of a more either punitive remediation kind of perspective. And that's why I think people have myths about what actually is a coach. They get very confused about whether it's therapy. And I think the one thing to also understand, especially in my story too, I was not depressed. I had no anxiety. This was not about healing. I've done that work. That part already happened. For me, it was about I wanted to level up. I needed to perform better. And I think the hard thing in most of our organizations and most of our professions, you know, nurses or physicians or pharmacists, they all have sort of mentorship programs where it's about, let me show you how to move up the ranks. Let me show you how to do your project so that you can ascend in this organization. Let me get you connected to the right people so that you can move up right here. But you and I both know business is not this way. Innovation is not this way. We need to dream the impossible and find very diverse perspectives in order to execute something that doesn't exist yet. And so I think this is why I think in business and entrepreneurship, there is much more coaching, because coaching is to get you to a new level, an athletic level, a mental level, an innovation level that only coaching can deliver, because it's not about healing the past. And it's actually about expanding the possibility.
Yeah, I totally agree. The healthcare system is rapidly changing. And I think some of the skills that we need to be prepared for beyond our curriculum or professional acumen is be ready to change, remain nimble, and resilient. And you alluded beautifully, creativity. I think that definitely thinking out of the box, coming with solution for the problems we have, and hopefully coming from the people that is experience those pain points, meaning the healthcare providers, right? The front line, the people that is on the trenches, is precisely what is most needed. And I always make this correlation, right? I work with and advise a lot of healthcare startups. They're trying to come up with solution, and that's been well documented that physician involving in the early stages is crucial for the success of any digital health company. Mm-hmm. And that creates actually opportunities for those that are ready with this itchy, that's curiosity, right? To try to kind of get involved. But as I said, I think there is always this. I hope this also becomes like a call to action, right? You're hearing this story, you're hearing these opportunities, and we just want to come from this place of I want to know more and see how I can use these tools, as you alluded fairly nicely. This is another tool of my kit that I have for kind of manage the challenges of being a practitioner in a very, very dynamic healthcare that is rapidly changing. So in that regard, I want to ask you specifically for you, like, can you tell me, like you alluded clearly, as a single mother, healthcare leader, how do you balance and maintain equilibrium between your personal and your professional life?
I think it's actually doable primarily because I'm very sort of organized. I think in my time audit, right? Because you're probably a productivity geek as well in terms of really always trying to like leverage your time in terms of all your different identities and roles. And I think, as I work with my coach, for the last 2 years, that's one thing that I've always talked about a lot, because I don't want to give up those roles. Those roles still mean a lot to me, to be a mentor for critical care physicians in the future, to direct their wellness programs, still to teach them things like difficult airway and creating new simulation programs. So that still is, the good thing is simulations does have some creativity in it. So it is in alignment with my values. And so there is that part of me that still wants to be in that space. And the good thing is that things will naturally happen when they naturally will happen in terms of changing or pivoting and just going towards the next yes. I think the one advice that is for me at least, is a little bit different from what you probably hear many younger physicians or mentors to say no. Say no to this, say no to that, have boundaries for this, don't do this. Well, if you do that, then you'll never be where we are, right? Like if you don't get curious and you think about, well, maybe I can try it, or let me see if I can do it part-time, or maybe I can just do a time-limited, let me just check it out for 6 months. I can change my goal. You actually have agency over everything that you're doing. Just because you say yes to a particular committee or a project doesn't mean you're handcuffed to it forever. So I think people don't really realize that everything is actually an opportunity to add to your experience. And the more experience you have means your greater flexibility, greater awareness of how different perspectives see the same problem. And even if it's purely a service capacity, you learn how to work with people, you learn how to produce content, you learn how to become smarter in a particular type of knowledge area. There's always a benefit. The question will be is fitting it into your goals so that they are encapsulated, so that it doesn't become this forever relationship that you have that doesn't have an end, because that means you're going into that that project with a particular goal and an outcome and something you want to get out of it. I think many entrepreneurs see this as well. You invest in something, you think about it, you design the project, and at some point there's also an exit strategy. It's like, do I want to exit this? Do I not? Is this forever? Probably not. It's going to evolve over time. You're either going to ride with the evolution. I mean, I've been in my academic position for 18 years. You're going to ride with the organization, or you're not. And that's why I think for some people, they have to make that choice at some point. And if you always say no, then of course you're going to move on in some kind of way. Then the only sad thing along that process is that you may not have capitalized on every opportunity to you. So in terms of going back to your original question of how do I balance it all, I just am really intentional with my calendar to make sure that I can see there's parts when I'm being mom, there's parts when I'm being program director, there's parts when I'm being simulation teacher, there's parts when I'm teaching for national, there's parts when when I look at my color coding, as long as I see the rainbow, I'm happy. So like when you eat, there should be rainbow when you eat. So that's sort of how I look at my calendar.
I love it. So I want to piggyback on what you were mentioning about the saying no, because the way I see it is two things. One, it doesn't have to be all or nothing, it has to be like just be seen as another experience, right? When you want to learn from. And I think that oftentimes people feel like take into any specific task or role, like it's a lot of nothing, right? If you don't succeed on that, basically your life is at stake. And that is not the case, okay? More for a young physician, right? And at the same time, you might learn a lot in this process. Now, on the flip side, though, I think that setting boundaries is important, though, in healthcare, right? So because we are not necessarily trained, and I guess new generation is more sensitive to this point. We are more of a generation that we were just go to the trenches and you make it work no matter what with the resources that you have available. So now, however, I think that definitely there is opportunity for people to take risk. And I think that a lot of people, all this thinking about all of nothing mentality will lead to inaction. And they are just stop growing. One of the concepts that I love and I embrace myself, I'm here for the infinite game. I'm always learning, I'm always growing, I'm always doing something, because at the end of the day, going back to purpose and value, that's precisely one of my most powerful value. I like to serve others, right? And one of the biggest purpose for me, again, is also creativity, that make me feel fulfilled, and thinking out of the box for solution. And I see a lot of healthcare innovation, and I want to kind of touch base on how do you see the future of healthcare. And actually, in two aspects. In the aspect of coaching, how do you see the coaching industry, if you're going to use that term, in the future, specifically for healthcare? But also, how do you see healthcare in general, considering all the changes that we're experiencing, new technology, artificial intelligence? There is a massive amount of startups on healthcare, and that I think I'm very excited about all this.
I'll tackle the first one, the coaching industry. I think it's going to continue to grow. Already in medical schools, due to a lot of work from Carrie Palomara from Harvard, has multiple sites in the medical schools. The coaching is now considered a type of educator role for medical students, so that in the School of Medicine, even in Pittsburgh, you can be a coach for the students. And so your job is not to be the teacher or the mentor or the clinical clerkship director or the curriculum designer, right? You're not in charge of them. You're the guide on the side as they come and debrief challenging clinical learning environments. How might they show up differently, learn better, be more efficient, stay in growth mindset, right? So I think there's definitely a role they've already incorporated into many medical schools across the country. So I think the normalization of coaching in the learning process is one application. I also think because well-being is such an emergency, because with so many chief wellness officers now across major healthcare systems, it's normalized to either have internal and external access to different coaches. So I think that's also growing as well. So thank goodness for chief wellness officers, and thank goodness for the systems who are trying to systemically look for opportunities for what kind of programs can you put in place, and obviously access to coaching and different cohorts of coaching. So Sunny Smith, obviously with Empowering Women Physicians, has shown that, for over 200 women in a particular way that she delivered her curriculum, markedly decreases all the burnout scales. And so we're starting to see the data that whether you're a, in-practice physician to a budding physicians in junior in training, there's applications for the coaching mindset. And the AMA obviously supports that as well. They actually have calls for programs and grant funding for that. And so I think that it's going to continue to grow. It's going to continue to normalize. And I hope obviously I'm successful in continuing to spread the word for all professions in healthcare, not just physicians, because obviously I've mentioned 3 major physician sort of related endeavors. But I'm hoping that it will also spread to our nursing colleagues, because, a physician and nurse are the leaders of the hospital, usually, generally speaking, of most organizations, chief medical officer and chief nursing officer, right? And so I think those have to go hand in hand together in that partnership. Both need to be coached throughout that journey, especially because it's not something that anyone teaches in any curriculum except through life. And mentorship programs are good. They definitely have a role. Executive leadership programs, MBA programs, they definitely have their role. But there's a lot more of the knowledge and cognitive science. Coaching really is about your own individual performance. And so I think there will always be a marrying of both the knowledge side, the MBA kind of side, ACHE side of things, versus the performance side, your individual performance. In terms of the innovation, I do think that I'm really hopeful that things will be as easy as just speaking out that I need these things. And I've talked about this with other people on my random night shifts, my Alexa for rounds, where we're just talking and we're having an intelligent conversation. And there's also the little AI assistant listening. Sort of, may I interject and summarize? You've all talked about these things. Would it be helpful if I brought up a reference that would be directly related to the questions and the evidence-based problems you're tackling today? Yes, thank you. And then a hologram would appear, and then we would think through it. And can I provide you my summaries? Yes, these are the 3 main points. And then we think through, how does this apply to my patient right here on rounds? And then we say, great, thank you, Alexa, for rounds. Can you please now order the CTPA that I'm requesting, because this is a high risk for PE? Because we've talked about it together, we've thought through the process, and we leveraged the ease of finding evidence data and then talked about it because we make the decisions as the humans. And then we also don't have to do any more clicking, right? There should be no more clicking. Why is it easy enough for me to order my Starbucks or order my sandwich? It should be just a few touch buttons, whether it's holographic or it's actually on a touchpad. And the AI helps us give a recommendation based on your conversation. This is what I'm seeing. And same thing in the clinic, in terms of it's already transcribing now, right? We're lucky that many systems are trying all the various different software companies that are trying to summarize the notes a little more efficiently. So I think that already is happening. Billing is also happening in an AI generated way. Bookkeeping is already happening in an AI generated way. Hopefully, there's a lot of more tedious tasks allows us to cross-check more and then have a discussion together as a team on, is this right? Is this not right? And so we have to actually refine our editing skills. We have to catch the errors. It's going to be interesting to sort of see how that process evolves as we have to hone some different skills in terms of really working our curiosity muscle, working our questioning muscle, working our prompt muscle. Is like, are we asking the right question? Because as we both know, the greater specificity by which we can identify the style and thinking things through so that the robot can actually help us, then the better it is.
Absolutely. Yeah, the quality of the output is in proportion to the quality of the input, and prompt engineering is so crucial right nowadays. It was beautiful to have this conversation with you, Lillian. What message you have to any physician that is hesitant about coaching or interested on coaching in general, and also how people can find about you?
Yeah. So for the interested in coaching, there's so many different types of coaches out there. There are different directories. I mean, I do actually think that it's worth shopping around and looking for people who will energetically vibe with you. I have met some people who really do enjoy the more cognitive style. Some people do enjoy more embodiment style. There's movement. There's actually some coaches that involve nature and therapy and yoga and meditation. There's all different spectrums. So you may actually find a coach that actually more will resonate with you simply because of there's other aspects about their philosophy that will resonate. I do think also it is important for certification. So being ICF accredited, I think, is a good thing because there are some exam standards in terms of the coaching program and also the coaching curriculum. And I think the reality is every single coach wants it to be a good partnership. No one will just force you to be a client. So it really is a relationship. And I think every single coach, I'm sure yourself too, we have a discovery call. We chat, we see, is this going to be a right fit? Let me see how I can help you. And then you think about it, sleep on it. And then it may later tickle like, yeah, you know what? This might be the right partnership for me to try. And the reality is, I think you try for a little while, get some accountability, make a determined intention for that relationship. And then you decide whether it becomes a long-term or short-term particular to get through a hump. For some people, it's really just about making through that career transition. I just got promoted. What do I do now? I can't get through this with no support. That's insanity. When you become chief or chair of a department, that's a lot of responsibility. It's a whole new ball game. For working with us in general, this is also for people who are maybe a nurse practitioner, nurse, PTOT, everyone else. We actually support everyone. And so for the physician leaders out there, we actually can come and support and provide coaching for all the members of your team, especially your key critical managers, which are instrumental for keeping your clinic and your systems running. So check us out at transforminghealthcarecoaching.com. We also have a podcast, Transforming Healthcare Coaching Podcast, and we'd love to have a chat with you.
Fantastic. Thank you for the conversation. And until the next episodes, folks, we'll see you until next time. Take care.